Injury tracking and injury surveillance are different because injury tracking is like our sportswear and is more of a computer-based system that is able to track the athletes individually. And this can be taken as writing down the specific injury that they got, and also like writing down daily treatment plans and logs of what they've done and what else they need to do. Whereas injury surveillance is more of a injury trend that is based on the groups of the specific sport, and also it is on yearly numbers, not daily numbers or daily trends as the injury tracking is. And it's more of the, like I said, it's more of like the group injuries instead of the individual injuries. The benefits of having the injury surveillance is being able to see which team has more injuries. Some teams may have more injuries than others, and this way the athletic trainer can track which teams have the most injuries, and if that's just because it's a bigger team or if it's depending on what they're doing. Also, it could see which team has more injuries during practice or games. Like I said, it just depends on the size of the team and what sport it is, because each sport is different. And also, this will be able to tell if there are more injuries, like surgery injuries that are needed, surgery-ending injuries, or just injuries that can be treated in the athletic training room or having to go to therapy. And then this can help see which sport has the most again. And then it can compare, like I said already, but it can compare the different sports and the different injuries that are happening. The barriers for this is that some teams are smaller than others, so if there's a larger team and more injuries, then it wouldn't measure out and be able to compare to a smaller team. Also, not all sports have the same intensity, so this could factor in the different injuries that could happen, such as football. It's a high intensity sport, so there's probably going to be more injuries than compared to golf, because golf is a low intensity sport. And then also it could also a barrier could be that the school not having enough athletes to be able to get adequate exposure of injuries and numbers to help with this, because since it's based on a number tracking system and yearly numbers, it may be hard to compare to see which sports have more injuries, because there's not as many athletes that are participating in sports at a smaller school, whereas there would be at a bigger school.